Colic is a condition that causes pain in your infant's gastrointestinal tract. Learn how to ease this condition and reduce the pain that your baby is experiencing. Knowing how to help a colicky baby should be on the agenda for every parent. Colic is something that is extremely common. In fact, it will prove to be impossible for your baby to grow up without experiencing this condition at least once. You can try to prevent it as much as you can, but unfortunately, nothing is able to offer a complete guarantee. In this video, we will discuss how to identify if your child is suffering from colic or another sickness, and what you can do to soothe them. When it comes to colic, baby reactions will always be your main symptoms to look out for. First, what is colic? This is a term that we have all heard of and experienced, but being able to identify the condition will make a huge difference as to how you can then treat your child. The problem is that colic symptoms are few and far between. Colic, which may also be known as baby or infantile colic, is a condition that is accompanied by both crying as well as abdominal pain. Of course, your baby is unable to tell you about the pain, but it is known that the two symptoms do go together. Some researchers indicate that colic may be an adverse reaction to a protein in milk, resulting in bloating, trapped gas, and general discomfort. According to the NHS, you need to examine if your baby cries for more than 3 hours at a time and for 3 days across the period of a week. There will also be no immediately apparent visible reason for them crying. They may clench their fists, go red in the face, bring their knees to their tummy, or perhaps even arch their back. They will also be very difficult to soothe to the point where you feel as if it's impossible. Of course, your child may display very few of these colic symptoms. In general, most children will stop suffering from this condition by the time they reach 6 months, aside from the occasional bout that we can all have from time to time. Of course, hearing your baby cry for such an extended period of time is not nice for any parent. All you want to do is rush in and help them in any way that you can, but it is important to do things right. What we recommend is trying a combination of these tips to see if your baby reacts positively to them and begins to feel more settled. Placing a lukewarm bottle on their tummy can help to soothe their abdominal pain. Of course, you cannot make it too hot, and it's always best to have a blanket protecting them. The warmth will make a difference, and it may even begin to pacify them as well. Colic in babies is painful for them, and this will make a difference. A known cause for colic is the baby inhaling too much air as they eat. In order to combat this, you can use a bottle that has a smaller hole on the nipple. It will then be easier to control what they are taking in and also reduce the chances of them gulping their milk. Probiotics can help with your baby's good gut bacteria, resulting in better overall belly health. Infant probiotics can also help with thrush, constipation, acid reflux, and gassiness. Mama Select has introduced a powdered infant probiotic containing 6 different strains of probiotics that is fantastic for this, and is easily mixable in about anything, including breast milk, formula, etc. Gentle motion is known to be extremely useful at helping to soothe a baby suffering from colic. One idea is to place them in a baby carrier of the type that is strapped to your chest. The gentle movement and the warmth that they feel from your body will make them feel safe and secure. Another option is to place them in a swing or stroller and gently sway them. Once again, you are looking at soft and slow motions, as that is the best way to treat colic in babies. Everyone knows that you need to wind your baby after feeding them, and this is something that does indeed work. You simply need to gently pat them on the back, and this simple action can prevent the wind from reaching their gastrointestinal tract and starting to cause pain and bloating. Include some soft swaying motions after winding them to make them feel more settled. White noise in the background can help to distract your baby from what is going on and how they are feeling. However, this should not be your main approach to helping them, and should instead be viewed as something supplemental. Slowly rocking your baby over your shoulder can help in a couple of ways. First, it will help soothe them while the heat from your body will also be of comfort. Your baby will sense this bonding moment with you, leading to them feeling far more relaxed. Any tension, which is caused by them feeling pain, can then effectively be released. This in turn may very well help to soothe them and stop them from crying. Research has shown that continuing to feed your baby as before is something that needs to be continued. Of course, you can try changing them between breast milk or formula, as it is entirely possible that they are having some kind of reaction to one of the milks. Unfortunately, this is going to be trial and error with you paying close attention to their reaction. Some parents do swear by anti-colic drops along with various herbal remedies. While they may work for some, you do still need to make sure that you wind your baby after feeding, along with incorporating all of the other points. As we said earlier, you cannot avoid your baby developing colic no matter what you try to do. However, as a parent, you need to be willing to try a number of different approaches to then ease the discomfort they are feeling. This is distressing for you as a parent to see, but your baby is not enjoying it either. Do what you can to ease their pain, and be prepared to take action for when that bout of colic undoubtedly strikes. Thank you for watching. If you liked this video from Mama Select, please subscribe below. See you next time!